Can exercise get rid of pain? I'm going to answer the question of whether or not exercise can get rid of pain. In all my years of practice, I've worked with a lot of people that have severe and chronic pain. It could be from arthritis, it could be from diseases, injuries, surgeries. There are so many things that can cause pain. And a lot of times when you're working with seniors, that pain is something that's just unrelenting. It's chronic. And I know that a lot of times for me to help someone learn to walk again or to be able to function more, I have to help them reduce their pain. In all the research I've done, there are many things that can reduce pain. There's medications, there's surgeries, there's even exercises that can help get rid of orthopedic problems to make someone feel better. But what about when someone just has constant pain? It could be in the knees, the hips, the low back, the shoulders. The first thing that you have to understand when you're talking about getting rid of pain is, what is pain? Pain is always caused from a stimulus. Something is stimulating our nerve endings. That stimulus travels up a pathway and then gets into our brain so that our brain can perceive it as pain. I guess we all know that. But the thing is, those pathways have many junctions. And at each junction, there's neurotransmitters that have to communicate that signal to the brain. There's one neurotransmitter called substance P. It's present throughout everyone's body. When you sense pain, you sense it because substance P is being triggered to allow you to sense pain. If for some reason you have a lot of substance P in your body, you're going to perceive pain more easily than someone who has a lower level of substance P. Substance P is a measurable neurotransmitter. It's actually a neuropeptide that's in our bloodstream and it's throughout the body. When you have an infection, when you are depressed, when you have a virus or a cold, when you already have an injury, your level of substance P is actually higher. So the more inflammation you have in your body, the more you sense pain. We've all been sick. We've all had the flu and felt achier, and we feel our neck pain and our back pain more than we usually do. That's in part because when you have a cold or when you have a flu, you actually have a higher level of substance P, which makes you more sensitive to pain. One thing that you might find interesting is aspirin, Motrin, Tylenol. All of those block our reception of substance P. When you take any kind of painkiller, what you're doing is you're changing how that pathway works. So normally what happens is, when you have something stimulate your pain receptor, substance P needs to be present for you to actually get that signal to travel along the pathway to get to the brain to perceive the pain. So in talking about substance P, you might wonder, well, what lowers it? Well, a lot of things do. Being happy, being less depressed, being exposed to sunlight, all of those lower your level of substance P. One of the most effective things that can lower substance P dramatically is exercise. Whenever you do exercise, your level of substance P in your body is actually lower. So whether it's strength training or going for a walk or doing aerobic exercise, all of those lower your level of substance P. They also have an effect of long-term keeping your level of substance P lower even when you're not exercising. So what this means is someone that has pain, if they're able to go for a walk or do some chores or even just go exercise in a gym for a few minutes, that they're going to feel a lower level of pain sensation. It doesn't change the stimulus. It doesn't change the source of the pain. But what it does is it changes our perception of pain. I hope you found this video helpful. Click the subscribe button if you want to see more videos like this. If you would like more help with your balance, look in the description for a link to a course I created that can help anyone improve their balance at home.